Today, I wanted to talk about coronavirus a bit, but this will mostly be from a personal perspective, and while based on fact, will feature quite a lot of the moral and social effects that I will be giving my opinion on. I'm planning to do another video based around more political timeline of COVID-19 and some of the decisions made, but for now, I think I wanted to make something a little bit more opinion based, a little bit more of the moral and social aspects that tend to sort of be ignored by arguably impartial news outlets. I don't think we'll need much more introduction, so we'll get started. The government's failed response to coronavirus has been characterised by things such as leaks from senior sources that the government didn't want to go into lockdown in the first place, the strategy and theory of herd immunity being adopted by the government at the start, cuts to the emergency stockpile for years now, NHS cuts in general, and token gestures to the NHS staff such as medals. And of course, let's not forget Dominic Cummings' breach of lockdown and failure to apologise in a strangely called press conference. So I want to get a little bit deeper into these. Firstly, I'll talk about, I believe it was a leak from a cabinet minister, that the government did not want to go into lockdown in the first place, and only did so because they felt public opinion was in favour of it and that they were under pressure. This was released whilst Boris Johnson was in hospital. This kind of statement shows us that the government has not been in control and has not had a clear strategy to protect the public to fight the virus from the start. Forming a lockdown strategy when many other countries have already done this straight from the start pretty much, based upon public opinion and the idea that you're under pressure rather than, actually having that strategy in place, and then having it released from a senior cabinet minister whilst the Prime Minister in hospital it's a pretty interesting move to say the least. And the second one I really wanted to get into, just to get it out of the way of, is there isn't really much more I can say about Dominic Cummings breaching lockdown that hasn't already been said. But it is still an important event that shows a clear lack of understanding between the top people in government and the public, so I'll go into it anyway, very quickly. Cummings claimed that any parent would understand, etc., his actions, whilst failing to realise and address the fact the reason so many people are angry about his breach is that they have had to say their last goodbyes on a video call while their loved ones passed away alone in hospital. These restrictions and casualties were also part of the government failure to address the virus early on, and Cummings' policies were a part of it. So for him to break those rules and hardly, if at all, apologise shows serious contempt for the public and everything the public have been going through to try and maintain order, maintain people's safety, and just try and generally get through this for the betterment not only of themselves and their family members, but of everyone. And the fact that the chief architect of these policies, one of the main people who is responsible for things like herd immunity that led to so many early infections and deaths, and then the architect of the policy, to have all these restrictions in place after the fact, retrospectively, to then go and just flauntingly breach those lockdown restrictions, call a press conference just having a casual chat about it, deny to give an apology or that he would even resign. It is disgraceful in the face of what those people have been through. And, if people saying that they don't really understand why Cummings has been in the news so much and why so many people are going on about it, from my perspective, that would be one very good reason why. Some of the more straightforward reasons that I put here, such as NHS cuts and cuts to the emergency stockpile, quite easy to explain, but I felt they were still very important to put on. The fact that, the emergency stockpile has been cut since I believe it was 2015, after being originally raised, I believe, in 2010, due to they felt there was an imminent threat of a virus, some sort of, coronavirus type spreading and killing a lot of people, potentially just infecting a lot of people. They put provisions in place. Consistently since 2015, they have been not adding to the stockpile and in fact cutting it. And this has led to, I believe it was something like £40 million worth or something like that of, it's primarily PPE, to be honest, has just not been added or has been redacted, so the overall value of the stockpile fell. We're being one of the biggest crises during this has been the lack of PPE for, and not just NHS staff across the board. All frontline staff have not had, they've had restricted PPE. to the point where I believe it was Matt Hancock came out and said that NHS staff were misusing it and wasting it. And then, straight afterwards, this figure comes out that actually it's been the Tory government's cutting the stockpile has probably been part of the reason why, amongst many other reasons due to procurement, that they haven't been able to get all that PPE together. So the cuts to the stockpile have been more directly affecting the coronavirus, but also things like the overall cut since 2010 under the coalition government to the NHS and peripheral health services as well have caused huge impact. The fact there isn't enough nurses, the fact there isn't enough, nurses haven't been paid very well. The fact that there aren't enough doctors, junior doctors, healthcare, staff in general, anyone who really works in those hospitals, keeps them running, keeps them a well-oiled machine, has been, it's decimated it. And that's led to more nurses, more people having to even come out of work and retirement. It's led to healthcare staff not being able to see their own families for days, weeks, months potentially at a time. All of these staff have, had to go through a lot. These cuts have made the NHS basically almost unable to manage the amount of patients. Now, normally, this amount of patients coming into a hospital will be pretty unmanageable anyway. But the fact that we've had a reduction in the amount of beds we can offer out, the NHS was previously in crisis before Corona hit. Certain areas of it have been privatised previously. They don't run at the same capacity as they were before. There's not the same amount of, healthcare staff on check, but also just general hospital staff. There's not enough of them. So everyone who is there already is working overtime. And as I said, that goes back to them not being able to see their own families. They're being more at risk, tying in the fact that they haven't been given proper or enough PPE. And, these people are at risk of spreading the virus or getting the virus and even bringing it back home to their own families. And they're being asked to do that day in, day out, whilst the Tory government have been cutting the NHS for nearly, a decade now. And that's another reason why the NHS hasn't been able to cope as well as it probably would have been able to before all of these cuts and before the staff were placed under such an immense amount of strain during this crisis. But let's be honest, before the crisis started, due to all of those cuts and privatisation and other measures, restructuring of the NHS, that's basically led it to be sabotaged even before this all started. And, that all kind of links into a general government attitude towards healthcare NHS workers, which is just that, they offer to give them a medal after all this is over. A medal. When these people aren't paid enough, many rely on food banks, as it's been well publicised. Many nurses especially have been in the news having to use food banks, which is disgraceful as public employees, but also as healthcare employees. They've been forced to use it for years now. And the fact that all the government can do is offer them a medal, which is going to be far cheaper, by the way, than, giving them a pay rise or properly funding their workplace so they have protections and they have the ability to actually, have a life, see their children, be with their partners and their families outside of this. Allowing them to have a life outside of this public service that they do. The fact that they've just offered to give them a medal, I can't really explain it any more than that. It's just ludicrous. It doesn't really offer any more than that, just that, a token gesture. And it's not really an acceptable way of dealing with healthcare staff after they've been through something like this and after so much that they've done. It really shows a contemptuous, devious way of dealing with these, with the public health services, because they just don't want to really address the heart of the issue. And these are the issues that they've caused, and they don't want to address them properly. They'd rather just sort of, brush it under the carpet, give them, a quick little decoration, makes them look good, the government that is, makes the government look like they care when in reality they don't. And, it's just not really the best way to deal with it. And of course, there's one of the main starting reasons that was a real tell that the government wasn't going to be able to deal with this properly has been the general theory and practice of herd immunity from the start of the virus. Herd immunity is not really a proven concept in science, I believe, as far as I know. A lot of people, in the scientific community debunk it, say it's not really a realistic way of dealing with these viruses. It was apparently, again, leaked that Dominic Cummings was one of the main, pushers of this policy, having no healthcare background, no real expertise or understanding in the field, was pushing quite heavily for a herd immunity policy. There are obviously a lot of theories around why he was probably pushing for it. Whether he believed in it or not, I don't know. But the fact that it's quite convenient is kind of come to light now that the government were aiming to not go into a lockdown, and it seems they would rather have sacrificed potentially people they viewed as being too old and too weak to contribute valuably to society. They would rather sacrifice them than allow the economy to go into any kind of lockdown, which kind of shows the lack of moral empathy they have, and caring attitude they have towards the public that they are meant to serve and protect. But also, it kind of shows that they're worried about the economic model that they've developed with austerity, and the fact that the economy is not as stable or in safe hands as a lot of people believe it to be under the Conservative Party. And while it's relatively safe to say that a lot of countries' economies wouldn't be able to do so well in lockdown, and a lot of businesses would close and there'd be a lot of instability because of a lockdown, it really goes to show how worried they were about our economy specifically, and the way that they've set it up and managed it and handled it with all this privatization, lots of debt, etc., etc. It really goes to show how worried they were. They were willing to sacrifice people's lives for it. But in general, the fact that they were backing this ludicrous theory that in the end has led to so many people getting infected and so many more dead. I mean, what kind of crisis response is that, and what kind of message does that give us? Can we trust these people? Considering the fact that this person who supposedly was pushing it so much is not an elected member of government, he's a special advisor, essentially, and obviously has had other issues during this lockdown now as well. It really puts questions in my mind as to really, really how incompetent they are, or even worse, how contemptuous they are and not caring they are about the public, which is even worse. So there's a lot of questions that come out of just the herd immunity debacle in general, and we're not talking so much about herd immunity now as we're starting to relieve the lockdown. So it's something I thought would be important to bring back up again, because I really don't want it to be forgotten that they championed it so much, which basically led to us becoming, a laughing stock in the worldwide community, who are mostly already starting to recover from coronavirus. And the last point that I really wanted to talk about was the fact that we're now starting to ease lockdown restrictions, which is, would make sense. A lot of countries are starting to come out of lockdown now. Many of them are almost basically been out of lockdown for quite a while. Potentially borders are starting to open up to other countries as well, flights allowed in, etc., etc., which would all be fine, except for the fact that obviously the UK has not really managed to deal with corona. We still have a huge amount of cases. We still have a huge amount of growing cases coming in every day. We've been consistently failing testing targets. The government's own testing targets, they've failed. Consistently, I believe, for several days in a row. I remember at least seeing them being questioned on it in daily briefings and having to admit they'd failed, and having no real reason, explanation, anything, any kind of action that they could bring to meet those testing targets. But they also made the point of saying that they would not bring any kind of easing of coronavirus lockdown restrictions in unless they had track and trace up and running. Now, they were meant to trial it on the Isle of Wight. I don't know how well that went, if it went at all. And then they haven't even really implemented it into the UK in general anywhere else. And now they want to bring us into, a very near state of normal life without any of these track and trace possibilities, without a severely lowered case rate, and without the fact that hospitals are still not really coping as well with the amount of patients and caseload that they have. It doesn't seem right that schools are potentially going to be opening in less than a month. A lot of businesses are going to be opening. A lot of contact is going to be happening. And you can really see that sinking in with the public mindset. Not seeing so many masks on people as they're walking around. I'm not saying people don't care and they aren't trying, but it's normal to start easing off yourself when these other things start being eased off. It's quite normal. And that's why the guidance and the policy has to be absolutely clear, because we're not all experts on this and we all want it to go back to normal as quickly as possible. In general, it does seem like we are going back too soon, and the big worry about that is going to be if there is a second wave, which in the UK, of all the places, is potential. I think that it could be a highly likely there could be a second wave if things go back too early without track and trace. The potential is that we might have to go into another lockdown, and I wonder how well would that work. I mean, a lot of people have really suffered a lot of instability, a lot of mental pressure from being out of work potentially, or just, on furlough. A lot of people, 80% of their pay, 100% of their pay isn't enough, so 80% of their pay has not really been enough to sustain for several months on. There's also, the social impacts, things like that people have really been suffering. That amount of instability, to come out of it and then to go back into lockdown again, I mean, that's just, that's even worse than just one lockdown and instability. You're just adding so much more uncertainty. And that extends out to other institutions, government institutions, frontline services, and businesses that provide a lot of vital services. But any business in general is going to have a lot of uncertainty right now because of that. And if we do have to go back into another lockdown, that's definitely going to be a massive impact, if we can even manage to do it psychologically, because the public, I imagine, will be quite reluctant to go back. And I think polling even suggests that is the case, that a lot of the public would not want to go anywhere near another lockdown, quite understandably. So just to add on the end that point, that the fact that we're going back now, easing a lot of the restrictions off without any clear strategy, really clear advice. I mean, stay alert, that's not really clear advice, is it? That's, it's just one of those things that I don't think it's a great idea. But at the same time, I'm more worried about the fact that it just shows that the government really are not in control. They really don't have much of a line on this, apart from the fact they're probably just worried about the economy. They're probably worried about poll numbers dropping, because they're starting to become increasingly unpopular as lockdown goes on. Their poll numbers are dropping. Keir Starmer's personal and Labour's party poll numbers are starting to rise, as government has had scandal and crisis after crisis over this in their poor handling. I feel like easing restrictions is also a bit of a political move for them, just to try and get those poll numbers back up again, get people happy, and get people focusing away from all of these lockdown issues they've had with Dominic Cummings, and a lot of other issues that they've had during their lockdown, and just the general dissatisfaction the public seem to be beginning to have over their handling of the crisis management strategies. So that's just one last thing I wanted to mention at the end there, because I think that it has been a really important, or it could be a really shaping thing for the future, is these few weeks where we're easing the lockdown restrictions and how people deal with it, and also how much better the virus gets, because if it doesn't get much better, we could be heading straight into another lockdown. So those were just a few points. In general, the fact that the government just seems to be so underprepared and ignorant. Not only this, but the crisis have actively revealed that the policies of austerity in regard to cuts to healthcare, they don't work. And the attitude of the Conservative Party towards the public, especially those not privileged enough to be able to stay at home and not work, it seems generally contemptuous. I mean, the fact that when they were originally sending people back to work, it was all the people who, they said it themselves, if you can't work from home, then you need to go back. Those were just a few observations I've made based on things I've seen in the last few months, news reports, some other information that's come out, and I just wanted to do a video generally sharing my thoughts and opinions on that, some of the stuff that I knew about, some of the stuff I don't necessarily have all the expertise and all the information on. But yeah, I hope you enjoyed it, and hopefully I'll be doing another one on more of the timeline and the political decisions made around coronavirus, and that'll be a lot more factual and a lot more of the hard facts of what happened during the virus and decision-making processes that were made by different governments and different factions.